And I want to take a moment to express my hope that during these challenging times, everyone is safe and healthy. I want to thank my colleague, Congresswoman Watson Coleman from New Jersey, for joining today's conversation with Elaine Duke, former Deputy Secretary of Homeland Security. In Elaine Duke, we could not have a better guest to discuss how the ongoing pandemic might affect the long-term mission of the Department of Homeland Security. Throughout her distinguished career at DHS, Ms. Duke has served as the department's Chief Procurement Officer, the Undersecretary for Management, the Deputy Secretary, and the Acting Secretary. Ms. Duke currently works at Deloitte Consulting as a specialist executive. We can all likely agree that DHS has never truly experienced anything like this pandemic since it was established in 2003. Recent government shutdowns provide some insight into the effect pauses in work that we've seen in the department, but the current crisis is of a different quality and scale. For some, for example, some employees who were once treated as essential during past shutdowns are now no longer able to work because of the need for social distancing. Meanwhile, frontline workers faced even greater than normal risks by potentially exposing themselves to this deadly virus. And I worry about the long-term impact these risks will have on employee retention and morale. I look forward to discussing what effects this pandemic might have on DHS operations and the steps the department should take to minimize these disruptions. I also welcome any recommendations for Congress as we continue to work with the department as it confronts this crisis while making plans to resume operations. Before we get to some questions, I welcome Congresswoman Watson Coleman to say a few words.
Thank you very much. I am delighted to be a part of this conversation. I think a very important and timely conversation. I want to thank you for hosting this discussion. Of course, I want to thank Ms. Duke for taking the time out of her schedule to talk with us today. And I also want to reiterate your wishes that those watching today are staying safe as this pandemic continues to sweep through our communities. While we have Ms. Duke here with us, I hope to spend some time discussing the effects that this pandemic and the department's response to it will have on employee retention and morale, an issue that has been of concern to this department from years back. At a recent hearing, we heard about how morale at DHS is already the lowest of the large federal agencies. Frontline components like the Transportation Security Administration and Customs and Border Protection also have some of the lowest morale out of all government offices. And now hundreds of officers in those components have tested positive for COVID-19. Without prioritizing the safety and the well-being of employees while making plans for ongoing and future operations, I worry that morale will only worsen and it will impact DHS's mission. So I look forward to hearing more from Ms. Duke about this and having an opportunity to sort of interact with some Q&A on this important department. Thank you, and I yield back.
Thank you. And now, Ms. Duke, I would welcome any opening remarks that you have.
Well, thank you, Congresswoman, and it's really an honor to be here. And I think COVID is a horrible crisis for our country, but it is an opportunity for us to unite behind our spirit, our commonality. And I commend you for realizing that the people, the nearly 250,000 men and women of DHS, are its heart and soul. They're backed by technology and policy, but those amazing people that continue to serve through this pandemic are the heart and soul of DHS, and thank you for bringing attention to that.
Well, thank you so much. And with that, I'm really excited to get to spend so much time discussing this important topic. So I think Congresswoman Watson Coleman and I will go back and forth on questions. And so I'll start off really to kick it off where you left it, Ms. Duke, in terms of the heart and soul of DHS operations. One of my concerns is that we've had to suspend entirely in-person trainings conducted by the Federal Law Enforcement Training Center, FLETC, which is located in Artesia in the district that I serve. This is particularly disruptive for some DHS components like CBP, where newly hired law enforcement officers are required to have that training before they can fully onboard with the component. So I'd love to hear from you, Ms. Duke. How can you discuss how the suspension of FLETC training could affect components hiring and retention of law enforcement officers specifically?
Sure. For those of you that are listening to this call and don't know, FLETC does train all federal law enforcement officials, not just those of DHS. And so its mission is critical to the security of our country. And what another concern is that this training is residential and it's very long. Basic training is nearly the length of a college term. So it faces some of the safety concerns of other institutions when it's housing and training people. So what FLETC is doing is it's looking to reopen as quickly, as safely as possible in phases. Because of the unplanned closure in March, there are some people that have not had training or that were in the middle of training and they need to complete their training. Additionally, because it really is a federal-wide problem, the acting secretary is engaged in making sure that the priority students that get in, they do plan on opening in phases as quickly and as safely as possible. And I'm confident that they're ready to do that. And that is very important. Luckily, especially with Border Patrol, the numbers indicate that our border is still secure right now, but we do need to get those new employees through that training, and the plan is working currently.
Thank you, Ms. Duke. Yes, one of the early hearings that we had for Oversight Management and Accountability Subcommittee was on the importance of training. And FLETC remarked that their biggest challenge in training was prioritizing. How do you schedule all of the different training? So I really appreciate you identifying that as a specific need that we need to be acting on now in order to limit some of the impacts that we'll face.
Definitely. Everyone needs the training. You can't say Secret Service or Border Patrol or any of the other federal law enforcement groups don't need the training. So they are working at meeting the most immediate needs first.
Thank you. And with that, I'll yield to Congresswoman Watson-Coleman.
Thank you. So, one of the issues has consistently been the fact that DHS has never had the kind of workforce that is needed to conduct all of its various missions. It's had a hard time even retaining employees, even during times when there wasn't a shutdown, when there wasn't a pandemic like this. And I agree, this is unprecedented. What do you think that this pandemic is going to impact the ability of the department to hire the people who are particularly on the front lines?
Right. Well, I would love to say it would do something similar to what we're seeing for our nurses and doctors, where the American people would realize what a fine workforce it is and stand outside and kind of applaud them the way we have for our first responders and our nurses and doctors. For instance, in CBP, Customs and Border Protection and Transportation Security Administration, 80 to 90% of their workforce is still out there despite the pandemic carrying out the mission. And I think that shows the dedication for public service. So one of the things I think each one of us can do is, whether or not we agree with policies or the politics of our country, to realize the dedication and passion of those people. In terms of the actual employees, I think it is important to look at the retention and the federal survey and improving the workforce. I know at the Chief Human Capital Officer level, there's a major push for resilience of the workforce. I think one of the things this COVID pandemic has made us realize is that thinking about the family and mental health is important. I know we do that in Department of Defense, but this COVID has shown how even civilian employees would be what looks a little bit like deployed during these times. So I think we need to look at mental health, resilience, and we need to look at career paths and career development for these people that are in entry-level positions like the TSOs.
Well, I'm glad you brought
Go ahead, I'm sorry.
No, you go ahead. I want to talk to you about the TSOs a minute.
Yeah, I think providing the employees PPE and now making it mandatory for them to have the personal protective equipment. As small as that is, that's a big step in the right direction.
Some of us are advancing the notion of hazardous pay for those people who are on the front lines and in positions that particularly make them vulnerable to possible infection. The other thing that I'm concerned about is one of the reasons I think the TSO sort of employee situation has been kind of erratic and not consistent is that it doesn't have the same protections that other federal employees have under I believe Title V of the Civil Service Act. And so we've been advancing that issue because we think that the lack of having that coverage has impacted morale as well. Because under the civil service guidelines, you would have a more predictability in a path moving forward and moving up in the system, as well as a guarantee of stability, a greater stability and protection in the workforce. Do you have any thoughts about that and how DHS ought to approach that issue as it's moving forward to sort of ramp up and bring people back to work?
I believe, and I know the administrator of TSA is of like mind, that the non-Title V status of TSA should give it opportunities to take better care of its employees, and that they should seize that opportunity. For instance, not having the traditional civil service structure with the steps of the GS scale. They have the opportunity, and the administrator is pushing for longevity pay, which would allow them to compensate TSA employees, including the TSOs, appropriately. I also think when I was back in government most recently and did the work-life survey where I went around the country, one of the most important things for the TSA screeners was having a career path. They are in an area where it's very difficult for them to see their future in federal government. And I think that's a really important thing to look for as they move forward.
Thank you. I yield back to my colleague.
Thank you. Thank you so much, Congresswoman. Ms. Duke, I want to shift to the other lessons learned that we're seeing here. And one of the things that we've seen starkly when it comes to this pandemic is the importance of federal, state, and tribal coordination. And cybersecurity is another key place where that level of coordination is crucial. I'm proud to have supported HR 5823, which is the State and Local Cybersecurity Improvement Act, which authorizes a new DHS grant program to address state, local, and tribal cybersecurity vulnerabilities. What do you think the COVID-19 pandemic will teach us about how DHS can be a more effective partner when it comes to federal, state, and local action?
I think one of the primary areas, and it is along what you said about the bill that you supported, is the importance of the critical infrastructure sectors along with the state and local coordination. Cybersecurity is a cross-cutting threat. It is underfunded in the federal government, and recently we've heard more and more about the states not having the funding for the right level of cybersecurity also. But I think that going back to some of the initiatives under the new CISA organization, the Critical Infrastructure and Cybersecurity Agency under DHS, I think it's important to have the coordination. I think it's important to have the critical infrastructure partnerships, which have grown during this COVID crisis, so that we have industry aligned with that. And I think it's important to have the relationships within the states with like the forward deployed CISA personnel that are working on many of these issues with the state and local government. So I think it's a combination of partnerships, funding, and the policies that go along with it.
Thank you. I appreciate that, and certainly recognize that coordination requires really clear roles for each entity to play, and how we make sure that we are advancing and creating an environment where everyone can work together in future efforts. Another one of DHS's mission involves travel. So I want to shift very briefly there. The coronavirus has clearly had a significant and direct impact on how DHS carries out its many missions, both internally and externally. For example, the Trusted Traveler Enrollment Processing Centers, such as CBP's Global Entry and TSA PreCheck, and also critical immigration and citizenship services that have been shut down nationwide. As we ramp up, we're going to face real challenges with that program. What type of backlog do these disruptions cause in the DHS workload, and how can we best anticipate that and prepare for that moving forward?
Well, I do recognize this is creating backlogs, and there's a couple challenges. One is some of those organizations like USCIS, they are fee funded. They have very little federal appropriations. And so this is going to be something challenging to get back online because they can't be, without funding, they can't process the applications that garner the fees. And so it becomes a defeating circle. So that is something that I think we have to look at is not only appropriations, but these agencies like USCIS that are predominantly fee funded, how do we as the federal government want to jumpstart them so that we can start providing those critical services to them? When you talk about like some of the TSA or the CBP Global Entry and Trusted Traveler programs, that's even more important because that's our ability to get voluntary biometrics. And so that contributes two ways. One, it is more secure. Secondly, it allows TSA and CBP to move more towards less contact screening. And so that is a double-edged win. And so it's very important. In fact, they're looking at those programs right now and seeing how can they change enrollment so that they don't have the unintended consequence of minimizing enrollment or renewals in those programs when the true policy goal is to expand them.
Thank you so much, Ms. Duke. And with that, I will yield to my colleague, Congresswoman Watson-Coleman.
Thank you very much. And that was a very interesting discussion because we're very concerned about those programs, but we also recognize that people have to have confidence before they are going about traveling again. And we haven't established that confidence that it is safe and secure to go ahead on with your lives and do the kind of traveling, particularly social traveling that you might do. You know, we're getting ready to come upon hurricane season. And whenever we have terrific storms and all, we depend upon FEMA to step in there and to be of service. How do you see the impact of this virus and the work that FEMA is doing in this space affecting FEMA's ability to be ready and able with all of the resources that will be needed if we encounter some bad weather and some bad storms and what comes as a result of that?
Yeah, that is something that is extremely important, Congresswoman. We saw it back in 2017 when we had the three hurricanes kind of coming one after another in sometimes the same geographic location, sometimes a little different in terms of the most major impacts. FEMA is looking at right now setting up a second National Response Coordination Center because there's I think, correct belief that you can't run the national coordination that it stood up in support of HHS's lead on this emergency support function. So FEMA did use its current and existing NRCC to stand up again to support HHS. They are setting up a separate one in preparation for the hurricane season. I think it's going to be important to look at as stimulus packages are passed and funded. Is DHS receiving its funds appropriately for being able to do that? Not just the Stafford Act replenishment, but also the people and the extra employees that FEMA picks up as unseasonal for this. But the one thing about FEMA is they always get it done, and I think again this season.
Yeah, as a matter of fact, there's work that still has to be done in places like Puerto Rico and
Yes.
even the Virgin Islands as a result of the past disasters. So we want to be helpful and we want to know what Congress should be doing. And thank you for sort of giving us guidance about paying attention and thinking about the resources that we need to put in this that we would not have necessarily thought about. The other thing is that the department relies on contracts to get
Yes.
some of its mission accomplished. And I'm wondering if you have some insight into A, the impact of the virus on the ability to get that work done through contractors, and B, what do you think that the department has the capacity to do to be able to engage and protect the use of the smaller contractors? We've been working very hard to get women-owned businesses and minority-owned businesses opportunity to work in this space.
Definitely. And just before I go on to answer your question, just one closeout for your previous about what Congress can do and is doing. DHS has a tremendous ability through its mission set to be part of economic recovery. And I would ask Congress not to be short-sighted and look at things like travel is down, but look at ways where DHS, with its partnership with the airline industry, can help provide early return to air travel, cargo, different things like that, and really see how DHS can help be one of the spurs of economic recovery. And then
Absolutely.
that folds right into your question about businesses. That is absolutely critical, not just for DHS, but all the departments. Luckily, COVID has not affected DHS's ability to contract. In fact, they've set up a separate office in the Office of the Chief Procurement Officer. It's called CARE. It was set up by Soraya Correa. And they are looking for a single point of entry for all those technologies and those companies that have unique COVID type technology or products. And so there is a broad agency announcement out under a special authority that Congress did give just to DHS and GSA, so they can do these innovative awards of contracts to support this. And that is open right now. DHS is accepting proposals on a rolling basis through the end of August. And I encourage those companies that think they have an innovative product to reach out through that announcement into the industry liaisons at DHS. I think in terms of the socioeconomic categories that you mentioned, the small businesses, the service disabled vets, I think that's even more important than ever that we're using the federal contracting program to revitalize our economy that way. You know, post-Katrina, we had special law that allowed us to just work with the businesses in the devastated area. And I think there's ways to do it within the regulations, and there's ways where the agencies can work with through Congress and maybe have some special authorities to really target those either marginal groups or geographic areas that were most heavily hit.
Thank you. Thank you.
Thank you. Ms. Duke, just quickly, as part of your tenure at DHS, you served as acting secretary for several months. And there are currently 12 senior positions vacant throughout the department, from the secretary and deputy secretary to the heads of CBP and ICE. This is something that's been frustrating for me as the chairwoman of Oversight, Management, and Accountability, working to build working relationships with heads of these different components and starting to make headway only to then kind of lose those partners and have to start all over again. Most of these roles are filled by acting officials that continually change. How might a lack of permanent leadership affect the department's ability to sustain continuity of operations throughout future outbreaks of this virus?
Yeah, that is a challenge. I do know that the acting secretary, has a strong background and he's passionate about keeping DHS moving forward as a Senate confirmed. But I do understand your position at the turnover. I would say that the way that has to on is through the leading career people in DHS. You know, the political appointees are in senior positions. There's only about 200 political positions out of the entire DHS, with about, I think it's 18 or 19 Senate confirmed. So I think that right now, the senior executive service workforce has to unite with each other in addition with the leaders. And I think that's what that is going to carry DHS through. And I see that when I went out to the field, especially in some of the geographic areas like Dallas, where the organizations are co-located, they're really able to lead. And so I think that's what we have to rely on, is the leadership of those in acting, but the solidarity and trust of those career civil servants.
So just taking from that, you recognize the challenge, it sounds like, but there are ways to work within this and also lift up some of the career folks who are working very hard in spite of the changes of leadership.
Yes, and I think one of the interesting things is we're also preparing for a presidential transition, whether it's a second term of the same administration or a new administration. And in doing that, DHS has appointed its lead for presidential transition. And in doing that, one of the things you do is you look at that continuity. So the timing is perfect for that, of making sure that you have people in the positions that are going to provide the continuity. So I think that preparing for post-COVID and preparing for transition really work well in parallel to your issue you raised.
Thank you so much, and I'll pass it over to my colleague.
Thank you. Yeah, given what our experiences are, have been and are actually as we're going through this unprecedented pandemic, I'd like to ask you a question about DHS and how it's been operating before. If you have any advice to it, how do we prepare for the future? Specifically, DHS is generally given the components discretion to manage their own operations. Do you expect that this dynamic to continue as the department evaluates how to return to some degree of normal operations in a post coronavirus world? Because we all know that it's not going to be what we had before, but we don't know what it really is going to be. So thinking about having the role that you've had before, and even in the role that you have now and the wisdom that you bring to this, do you have any sort of advice to the department how to deal with that, as well as what can we do to assist, and what is it that the department should do to prepare for the future pandemic, because we'll have it again?
Yeah. So my advice on the level of department control is to find the sweet spot. And what I mean by that is absolute, everybody do their own thing, and absolute, you must follow these strict standards. I don't believe either one is correct. You know, OPM, OMB issued a joint memo that set forth the gates and the parameters for reconstituting the office spaces. And they are wide and broad. And I think as you go down the DHS hierarchy, they should become a little more narrow. And I think it's important for the acting secretary to put standards in. It would be very hard to explain to the workforce how, if you're in the same geographic area doing the same job, that you have a different ability to come back to work as somebody in the building over. But there's two major areas that would affect that. It's the geographic area, and it's the type of work you do, and also your personal situation, like, are you high risk? And so I think it's important for DHS to speak as the department and put some guidelines in place, but allow the right amount of flexibility so that those variance factors, like specific mission sets, can be used at the discretion, appropriate discretion of the operating components. I think in preparing for the future, which is kind of a second question, is I really think that looking at the national response framework and this specific emergency support function on the pandemic, I think that we should not do, maybe we do individual department lessons learned, or hot washes as we call them in government, but I think we need to do a federal one and make sure that national response framework that we put in place post 9/11 of how DHS fulfills its coordination role with different agencies having the leads, that all those pieces are working individually and then collectively as a system. And I think that would be the most effective for our country.
Do you anticipate, there being a, a difference in coming back to work, that there'll be shifts and there'll be rotations and, part-time, home, part-time, in the office, things of that nature that should go
Yes,
along
my
with coming back?
understanding is that's going to be one of the first phases, is less density. So
Mhm.
I've heard of some offices that are looking at like dividing themselves into 3 groups. You might know on submarines they have a blue crew and a gold crew, and they alternate going out to sea. I think we'll see that type, and also I think there's more confidence in teleworking now. When people have seen it actually work by this crisis. So I definitely don't think you're going to see an immediate return to the same density. Additionally, there's concern over mass transportations in areas such as the National Capital Region. How is the federal government, where we have a huge federal workforce, how is that going to be aligned to the reopening of normal commutes? And does the public, do the employees do you feel like you can take a taxi now? Do you feel like you can take the metro now? Because what precautions do they have in
Yes.
place? That's all part of the system.
Yeah, I can't open my Facebook page without there being a list of deaths from public transit workers. So that definitely is an area of concern. I want to hand it over to my colleague and my friend here.
Thank you so much, Congresswoman. Just to follow up on Congresswoman Watson Coleman's comment about one DHS and how do we manage and coordinate, as you said, the multiple components while recognizing how much communication and shared effort there is required to do all of their missions. Just from a personal standpoint, I've seen in the midst of this crisis with COVID-19, the folks on my team who do the legislative work working so much more seamlessly with the people in New Mexico to make sure that all of our efforts when we're talking to the administration or when we're drafting legislation are really grounded in the immediate experiences of the constituents. And so as we move past this, we're trying to identify clear systems that will retain that healthy feedback back and forth. And so I'm trying to transpose that onto the one DHS theory of right now in the midst of this crisis, are you seeing any places where different components are working very well hand in hand together, finding new ways to coordinate, and how we might be able to continue that coordination on into the future?
Yes, I definitely think so. I think that sometimes it takes a crisis to really prompt change. One of the first leadership gurus, Deming, said that you need crisis to really push dramatic change. And I think DHS is seeing that, but it's seen it a couple times before. The December 25th, what is affectionately called the panty bomber. And so I think this one being as long as it was, I think the 2017 hurricane season was so devastating that it really brought them together. And I think each time I see DHS ending up closer and closer as a community. I think that that is especially true in the field, as I said. I think in the National Capital Region, it's harder to drive that. Interestingly enough, because we're co-located, but I think I'm seeing it. I think people are seeing they need each other, and I think they're seeing they can trust each other, and that's what's most important. You're seeing that as a fellow DHS component, I have your back, and I have the same interest in the common mission set, and it's really encouraging. And I think it's not only at an organizational level. I think it's at a human level. One of the things that's most great about federal law enforcement is, you have those little sibling rivalries. Well, I'm FBI, I'm Secret Service, I'm HSI. But when push comes to shove, the sibling rivalries are over, and we're all law enforcement and in it together. And I think we're seeing that in DHS.
That's wonderful. I think we're coming close to wrapping up. I want to turn it one last time over to my colleagues who have any remaining questions.
Yeah, I just would like, thank you. I'd like to have some, if you have any thoughts on a couple of things. What does this social distancing going to mean in terms of how those frontline workers, whether or not it's CBP or other folks that work on the front line, what is that going to look like, do you think? And also, do you think that this pandemic is going to inform ICE in the way it executes its sort of who they go after, who they detain? Or will they prioritize really those who are most harmful to us as opposed to those who just happen to overstay their visa or their stay here?
There's so
That's
much
an
in
easy
that
question,
question.
right? That's an easy question.
It is a very meaty question. We could have done the whole 45 minutes on that one question.
Okay, we'll hold you to that.
I think the front line is going to be performing. The work. I think we'll start to see more density again, like at the land borders, the airport borders, and air travel in general. So we'll see more density. We're still seeing the social distancing similar to you see in the grocery store, where you have lines and you stand 6 feet apart. But I think that they're going to report to work. They're going to be given the appropriate personal protective equipment, and we're going to make sure they're monitored and taken care of if there's any incident. But I think that most of the DHS employees know they're essential workers, and they are going to comply with the policy of reopening. And that's why it's most important to get us right, because this isn't just something we're arguing in a conference room. This is not only regular traveling people or just going to the grocery store people. It's employees and it's their lives. So I think we have to get it right. And I know that our employees in DHS and the other federal agencies will comply. I think in terms of and I think making sure they have that right PPE and that right medical availability, both mentally and physically, is very, very important. We've seen a lot of mental strain in our country due to this. In terms of ERO and ICE, I have not seen I have not heard any changes in what's going on. I have not heard about much activity. So I think that everyone during this COVID time is trying to do the right thing. And I think I've seen a rise in individuals' compassion, and we're starting to see our similarities rather than our differences. And that's just not an ICE thing. I think that's a country thing. And it may sound a little Pollyanna, but if we keep going in that direction where, how am I the same as my neighbor, or how do I have compassion for them? I think that we'll come out of this better. It certainly won't make up for those that have lost a loved one. It never will, but let's at least pay tribute to them by being better human beings as we come out of this.
That's
Sorry, that was a
something
little
that I appreciate that, because if you're Pollyanna, so am I, because I think that when we come out of this, we're all going to be better people, and we're all going to be more compassionate and understanding and respectful of one another. I believe out of these adversities comes an opportunity. Thank you so much. I've really appreciated your spending time with me.
And thank you for giving me the time.
Thank you.
Thank you so much for being part of this conversation. I think we've got some great themes here. Really appreciate, Ms. Duke, how you began reinforcing how the heart and soul is the workers and how we recognize that work. Congresswoman Watson-Coleman, thank you for bringing up how we care for them, how we make sure they have the mental health care support that they need, supporting their efforts as essential workers through hazard pay, something both my colleague and I have supported through proposed legislation, also through making sure that their training is consistent so we don't have the backlogs. And then I just appreciate how we're talking about coordination, making sure that the one DHS model is supporting all of the components parts. And lastly, looking ahead towards a long recovery, how we take these lessons learned, continue to be responsible as we re-enter into travel and others, and how we make this a better response going into the future. So with that, before we conclude, Ms. Duke, would you like to offer any closing remarks?
No, I think this is a wonderful opportunity, a wonderful dialogue, and I appreciate both of you taking the time to be thinking about how can we make the country a better place and what specific things we can do in Homeland Security. Just to summarize, I think we need to continue valuing the DHS workforce. I think we need to see the economic security that our Homeland Security provides. They are not dissimilar. They are one and the same in terms of they each create the other. And I think that as a country, we're in this together. And I think that putting the resources behind it, the attention, and the focus can really help us sustain some of these crisis operations we've put in place and these better technologies and practices and sustain them in the future.
Thank you so much. Congresswoman Watson-Coleman, do you have any final words?
I just found this discussion rich, and I look forward to having other discussions with Ms. Duke as we explore some of the other things that the department does. I agree with you. It is a very important department. It works very hard, and I have tremendous respect for the folks that are on the front lines, as well as those who are in headquarters and who are thinking about how we keep our country safe and secure. Thank you for taking the time with us. And to you, thank you so much for hosting this.
Thank you all so much. Thank you to everyone for tuning in. Ms. Duke, we really appreciate you taking the time and sharing your expertise with us today. Your insight, as usual, will be valuable to the committee as we work to confront these future challenges. I also want to thank the Homeland Security Committee staff for your innovative ways to continue to do committee work here. And with that, I close today's forum. Thank you all.